Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Indriani, and in this video I want to talk about COVID-19 or coronavirus. As we all know that coronavirus or COVID-19 is still very scary threat. Some countries do many ways to stop the spread of the coronavirus change to save its people. Why is coronavirus so dangerous? The dangers of coronavirus or COVID-19 is the transmissions is faster and easier than the SARS outbreak that hit the world in 2003, as quoted by Financial Times. Within a period of 5 months, our first case was discovered in November 2019 alone. It had reached 935,957 positive people in the world. The coronavirus attacks the human respiratory tract. A person can be infected from a COVID-19 sufferer. This disease can spread through small droplets from the nose or mouth when coughing or sneezing. Then the droplet falls on the surrounding object. Then if someone else touches an object that has been contaminated with the droplet, then that person touches the eyes, nose, or mouth, that facial triangle, then that person can be infected with COVID-19 or coronavirus. It could also be someone infected with COVID-19 or coronavirus when accidentally inhaling droplets from sufferers. This is why it is important to keep a distance of about 1 meter from the sick. That is a little explanation why we need to look after ourselves at home. Yes, it is better at home than traveling and engineering yourself. Well, I want to tell about the conditions of some countries in the world. The first is Europe. According to the report by WHO's European Director at April 16, 2020, 50% of the global burden of COVID-19 was in Europe. This means that more than 84,000 people died in Europe in the epidemic. As some countries start to consider whether restrictions may be eased and whether schools and some workplaces might start to reopen. Companies and politicians across the world are worried about the economic impact of a long shutdown, and some countries in Europe such as Germany, Denmark, Spain, and others are beginning to think about how to ease some social restrictions. The next is India. South Asian nations have so far been relatively unscathed by the epidemic, with around 10,000 cases and 339 deaths in India, according to official figures. In India, several states have already announced lockdown extensions, such as Tamil Nadu and Odisha. The lockdown in India has started on March 25, 2020. After India, we move to Chinese, or the central city where the virus first appeared. On Friday, April 17, 2020, the Chinese city of Wuhan raised its death reached 50%, bringing its total to 3,869. Some experts believe fatality these numbers in this phase in many other countries fail to show the real toll because some people have died from COVID-19. Other than that, the Xinhua News Agency report said that the Chinese government had approved the initial phase of clinical trials of for two coronavirus experimental vaccines. In other words, these two experimental vaccines will be tested on humans. The clinical trial was developed by was it Sinovac Biotech, based in Beijing, and Wuhan Institute of Biological Products. And the last country is Indonesia. Now we all know that the number of people positively affected by coronavirus is increasing. Indonesia confirmed its two first coronavirus cases on March 2, 2020. On Friday, April 17, 2020, the Philippines recorded that Indonesia is highest number of infections in Southeast Asia, followed by Malaysia and Singapore. That was some of the condition of the current state of the coronavirus. We all don't know when this condition will end, so don't forget to keep on praying that our earth will heal quickly. Always take care your personal health, and don't forget to wash your hands diligently and wear a mask if you have to leave the house. Thank you very much for watching this video, and wassalamualaikum warahmatullahi wabarakatuh.